and online. We are the Board District 7 team, so excited to welcome our students and families back to school. Thank you for helping us practice an in-person and Zoom event. This is our first one, so much appreciation. A couple of housekeeping items. We are recording our Zoom session, so it just popped up. We are recording and on live stream, so families are joining us from social media. If you're in the room, restrooms are in the back and our team can help you find restrooms. We also have water and snacks available towards the back that you can enjoy on your way out. And we have Spanish translation. Are we good with logistics, fam? Okay, we just need this one in here to also change, please. Great. We can go to the next one. I was hoping to be in charge of the clicker. I used to be a 6th grade teacher and I love being able to do that. Anywho, I am Tanya Ortiz Franklin, your school board member, and we're going to start with a quick check-in, a poll online and in the room using our hands. So on a scale of 1 to 5, 5 being super excited, so ready to come back to school, 1 being like, I'm not really sure, I'm not ready. How are we feeling? Are we feeling not so ready? Are we feeling 5s or somewhere in between? Let's show us on the poll as well. We'll give you a minute to show us how you're feeling. In the room, I'm seeing some 3s, some 5s, a couple of 10s, a couple of 2s. And I'll invite my team to show us the poll with where we are online of how we're feeling. We've got a little bit in the chat. Did we also do a poll or just in the chat? Okay, it's in the chat. You can see where everyone is feeling. Thanks for sharing your emotions. We're all over the place. And my goal, sort of, is to get us closer to 5s by the end of our hour together today. So thank you. Next slide, please. Objectives. What our hope is to do every time the Board District 7 team comes together is to build relationships. I'm so honored to get to represent and serve the families from South Los Angeles through the Harbor area and San Pedro. So it's always important that we have a chance to build with each other. And today, especially to build our collective wisdom. So our brilliance in the room about coming back to campus, all the safety protocols, and get a really good understanding of how we can keep each other safe and healthy as we come back to school. Those are our objectives for our time together. Next slide, please. And I'll just invite a couple of norms. Typically in our meetings, we invite you to step up and step back. We'll be capturing questions from the chat and also opening up the room here. We want to invite you to consider multiple perspectives. Some people are really excited to come back, ready to be on campus, and some might be choosing the online learning or maybe still making their decision. So let's be respectful of the diversity of opinions and experiences. We're also learning so much information every day. We're going to do our best to answer as many questions as possible, but any that we can't get to, we'll follow up with you as soon as we can. New information is coming out all of the time about this stuff. And we'll just invite you to practice active, deep listening to each other, to our experts here, for our friends from LA Unified and our community members, so that we're learning as much as we possibly can today. Thank you. Next slide. So how we'll spend our time is super quickly. I'll invite you to meet our team, our Board District 7 team, who gets to represent and serve our area. We'll start off with school operations at LA Unified with Eric Hansen and Pia Sadakwatma. Then we'll turn it to health and safety with Dr. Mahaltra from our district. Then we'll hear from Dr. Abraham about community resources. And finally, from Mr. Kim, our Markham principal, about social emotional resources coming back on campus. And we'll save plenty of time for Q&A. So keep thinking of your questions throughout our time together. Next slide. So my team, I'll invite you to stand up and wave really quickly, and you can see them on the slide here. Our Chief of Staff, Dee Dee, isn't here, but we have Emma, our Policy Director, Charnel, our Family Engagement Director, Stephanie, our Communications Coordinator, Marilyn, our Family Engagement Manager, and Kimberly, our Operations Coordinator. We are all here to serve you, and thank you to the team for helping to organize today. Next slide, please. Okay. We're learning how the tech is a little slower with the internet. So I will turn it over now to our district operations team to help us with how we're coming back to campus. Here it is, Eric and Pia. Thank you for being with us.
All right, a good afternoon, and thank you, Board Member Ortiz Franklin, and Thank you, Principal Kim, for having us today. Beautiful campus, and hello to all of our parents out here and at home. Again, my name is Eric Hansen. I'm here with the fabulous Pia Sada Kwatmal, and we're going to share a little bit about the opening of school.
Can you speak a little louder?
Sure. Okay, again, Eric Hansen, we're going to speak a little bit about the reopening plans for school. All right, there we are. I'm just making sure we got the slides on the screen match the slides on the computer here. Okay, so we do have our, we welcome everybody back to school. We have our copies of our family guide in English and Spanish here. So we have hard copies. If you're at home, we also have that on our LAUSD website. And Team Board District 7, we do have the links in the slide there to put in the chat. So we got links for that. Thank you very much. Next slide. And of course, we send a great welcome from our superintendent, Megan K. Riley, of course, sending her best as we open school, to our parents, to our students, to our staff, as we are excited for the opening coming up next Monday. All right, we have a brief welcome video from our superintendent.
Welcome back on board.
Welcome back to Friends.
Welcome back to recess!
Welcome back to sports!
Welcome back to class.
We're back, we're fully in person, and we have the strongest safety standards in the country.
Welcome back to school!
All right, yay! I love the welcome back video. Very exciting. Love seeing all of our students there with smiling faces and everybody getting back to school. All right, there we go. Of course, with our opening of school, we have, again, our full in-person learning, full in-person instruction, along with safety standards, as we're all wearing masks tonight, having safety standards with our masks, with our COVID testing, baseline testing, vaccinations, cleaning of campuses, all of these factors that go into making sure we have the safest and healthiest campuses. And of course, with face masks being required with our learning. Okay, and lessons learned. Pia.
All right, thank you, Eric, and good evening, families. My name is Pia Sada Kotmal, and I just wanted to say thank you to the families who really helped make the spring opening very successful. So what you see here on the screen are just words of gratitude to our teachers, to our students. Really, all the things that we learned from the spring is what's helping us inform how we're planning this fall. So on the next slide, really recognizing what our board members have shared from the very beginning. It takes a team, a village to make this work for our students. You know, board member Tanya Ortiz shares the gratitude for our labor partners, the teachers, the administrators, the principals who've been right there with us in preparing. Next slide, you'll also see just the different components that have helped us inform our policies, especially around COVID testing. Partners like Stanford, UCLA, Johns Hopkins really help us to make sure that when we're making these decisions, we're not making it in isolation. We're really keeping in mind public health guidance. On the next slide, as Dr. Malhotra will share as well, that we are looking at guidance from CDC, from County Public Health, and also California Department of Public Health when we're making these decisions and recommendations for our teams, for our schools. On the next slide, as Eric had shared, the face mask, the cleaning. We have MERV 13 filters, the same equivalent of those N95 masks that's constantly circulating in our rooms. And part of the information that Dr. Malhotra will share as well, it's like different layers surrounding and protecting our students. So when they're on our campuses, we're really building all these layers to make sure they're safe when they're with us. On the next slide, I'm going to have Eric now share information about COVID testing.
Thank you, Pia. And with our baseline testing, we thank you to our parents and our students, our staff, everyone for making appointments to come in, but you don't need an appointment. You can go right in. We do recommend appointments, but you can do walk-ins. We want everyone to be able to come in for baseline testing. It is a requirement as we start school on Monday. So again, please make an appointment or walk in to any of our testing locations. They are by a local district, and we are extending the hours. You'll see this weekend, we'll have testing on Saturday and Sunday. As we know, many families have been very busy getting ready for the opening of school. And this is just one more item that they are taking care of, along with all the backpacks and the masks, and of course the lunch boxes, which are always fun. So again, testing at all of our sites coming up in LDs this week with extended hours on Saturday and Sunday. There we go. On this slide, you'll see a little bit of different pictures here. Again, the slide on the upper left-hand side, that was last school year. This school year, we have our drinking fountains open. We have all of our restrooms open. Again, last year, you would see the do not use sign, or you'd see arrow signs or 6-foot distance signs. We'll not see that this year. We have our drinking fountains, restrooms open, hallways as we breeze through to our classrooms. Okay, part of our welcome back, we want our parents to know, or want our families to know, we have more reading and math teachers going to our elementary schools, focusing on primary promise. Again, that one-to-one tutoring that we had in place last year. And of course, technology for our students with the one-to-one devices. Also with the focus on mental health support for our students and families, and with staff there to help you connect. Pia, online.
Thank you. So another piece that we wanted to share with families, both in here and also online, is that for the 2020-21 school year last year, distance learning or hybrid learning was in place. So with the onset of starting July 9th, this school year, instead of online learning, the only online learning option is actually independent study. On the next slide, what's key about independent study is that students are getting credit for their classes. Students are getting credit when they submit student work. You'll also see on this slide that this program is offered with our very own City of Angels here in LA Unified. Just unmute, with Los Angeles Unified. And as part of this online independent study program, students will basically in elementary will receive 3 hours of live instruction with a teacher. And when they're not with a teacher, they're working on assignments and tasks on their own independently. For our secondary, middle school, and high school students, they get 3 70-minute periods per day, and they work independently when they're not with a teacher. On the next slide. So with that, that just concludes our piece, and I'm going to go ahead and hand back off to our board member, or Dr. Malhotra.
Hello, everyone. My name is Dr. Malhotra, and I'm the medical director for Los Angeles Unified. You can go to the next slide. So I wanted to, am I muted? Okay. I wanted to start off with a little bit of history of where I came from. Are the slides showing? Sorry. Okay, there we go. So I wanted to give you a glimpse into my life last year. I started at Los Angeles Unified this year in January. Last year, I was working for Los Angeles County Hospitals. And so last year in January 2020, my dad came home from overseas and he was telling me about a virus that had emerged on the other side of the world. And he asked me if I knew anything about it, and I read up on it and I thought, okay, like most of the viruses, it probably won't, come to this side of the world. Then, next slide. In February 2020, the first cases of COVID-19 started to appear in the United States. In the hospital, I was leading an inpatient unit, and there was still an air of ease. Some of us wore masks in the hospital, and some of us didn't, because we didn't want to scare patients. So by March 2020, the next slide, please, our ICUs and inpatient units started to fill up with patients affected by COVID-19. And for the rest of my life, I will always remember walking into work while the rest of the world was on lockdown and wondering if I was going to get a virus that had affected so many or bring it home to my family. And I will always remember disinfecting myself in the garage and not being able to hug my kids. You never think that you would live and work through something like this. Next slide. On April 26, 2020, my mother-in-law passed away from COVID-19. She was one of the first groups of people in this country to succumb to this disease. The New York Times called these losses incalculable losses. My mother-in-law, one of them. We could not attend her funeral. We watched it on Zoom. You would never think you would say goodbye to a loved one in this way, but this is the reality of this disease. A disease I thought would stay on the other side of the world came and directly affected my family. And it made me understand how incredibly interconnected we all are. Next slide. As Dr. Fauci said, the world is a place that is so interconnected that what happens to us in another part of the world, or what happens in the other part of the world, will impact us. And so when the public health or CDC, when they give us guidelines for masking, social distancing, it's not only just for us and our families, it's for our communities around us and the world beyond us. And so what are these guidelines? Next slide. So the first guideline is masking, right? You can go to the next slide. Is it okay? So the CDC recommends wearing masks in K through 12 schools and in public indoor settings for everyone, vaccinated or not, in parts of the US with substantial high numbers of COVID-19 cases. And with the Delta variant, that is where we're at right now. Next slide. And so many people, wonder, do masks work? And I will say, yes, they absolutely do. As you can see, the best situation is when two people are wearing a mask. That is the lowest risk, because what a mask does is it prevents those small droplets from the coronavirus from exiting your immediate area. So there's a substantially lower risk when two people are masked at the same time. Next slide. A very common question asked by many parents, and a legitimate question: will wearing a mask make it harder for my child to breathe? We only recommend that children under 2 not wear a mask for extended periods of time. Also, if there's children with other medical problems, you would ask your pediatrician about the safety of wearing a mask. But other than that, masks are safe for children. They're made from breathable material and they do not block oxygen. Next slide. And then the other question is, do masks retain carbon dioxide? So carbon dioxide molecules are smaller than respiratory droplets. They cannot be trapped in the breathable material like cloth or disposable masks. Another thing to remember is that professions such as anesthesiologists and surgeons and even dentists wear masks every day for most of their careers. and they have done well without harm from masking. Next slide. And so the best mask for a child covers both the nose and mouth. It fits snugly against the side of the face, and it's secured with ear loops or ties. Also, it should have multiple layers of fabric to block those respiratory droplets and should allow for unrestricted breathing. Usually if there's a little space between the tip of the nose and the mask, that's perfect. I love this image of someone wearing a mask on their head. Don't do that. Okay, next slide, please. So the next recommendation is testing. You can go to, yes. So LAUSD's testing protocols are very strict for the safety and health of our students and employees. So we require baseline tests 14 days before school starts. So there's still time, as we had talked about, there's extended hours, and that gives us an idea of what the prevalence is in our community and also prevents transmission in schools before we even start. And every student and staff, regardless of vaccination status, will be tested weekly thereafter. This is in direct response to the Delta variant. We want to make sure that we are adhering to the safest protocols that we can. And then our community engagement team will quickly identify and contact positive cases, and we work with the Department of Public Health to contact those positive cases and their close contacts. I can assure you that we are working closely with the Department of Public Health on our testing protocols and our community engagement. I talk to them pretty much on a daily basis. And we will adjust as their recommendations change. Next slide. So why is testing important? First, as we know, testing can save lives, right? So if we identify a student or staff who's positive, we can quickly inform them so we can protect their household members, the elderly, or the people in their household who are too young or cannot be vaccinated for some reason. Testing helps to keep our schools open. The most important thing is we want to keep our schools safe so that we can also keep them open. Testing also matters in those communities who have been disproportionately affected by COVID-19. We want to prevent the spread. Next slide. The next recommendation is vaccination. One of my favorites. Next slide. Just waiting for it to load.
The internet.
Okay, it's the internet. So as what is on the screen? Is it coming up on? Okay, so, oh, did we lose our presentation? Okay, so I am very proud of our vaccination efforts through LAUSD. So far, we've given more than 37 doses of vaccines to our staff through our school sites and our Megapod site. Our mobile teams with our student vaccination program has visited 160 middle and high school students to vaccinate children 12 and above. We also have 30+ partner clinics offering vaccinations to students and families. We have Kedron Health here who have been helping us with that. We also, starting in the fall, we will have 14 school-based clinics that will offer vaccines to our students. Next slide. And as a pediatrician by training, I deeply understand that vaccines are one of the most important advancements in modern medicine. Go to the next slide, right? Okay. I understand that vaccines are one of the most important advancements in modern medicine. I believe in the safety and efficacy of vaccines. The bottom line is that vaccines work. You know, it was only in the 1940s or 1950s when polio paralyzed and killed thousands of children a year. And in 1991, polio was officially eradicated from the United States. In 1977, the world declared that we were smallpox free. I still have the vaccine, my smallpox vaccine on I can still have the scar from it. And I got my COVID vaccine right above it. The bottom line is that vaccines work. I believe in the safety and efficacy of the COVID-19 vaccines. You can go to the next slide. So many people also question about the emergency use authorization of vaccines and how that process works. And contrary to popular belief, the emergency use authorization is actually quite extensive. What emergency use authorization is that it allows the FDA to release a vaccine or a medical treatment in a declared health emergency. So the EUA process goes through several stages. And the phase 3 trials of the Moderna and Pfizer vaccines had thousands and thousands, and for Pfizer is more than 43,000 participants. So we have a large amount of data to prove efficacy. There's also several independent boards monitoring this process to make sure that the results are not biased. And so the EUA process, why it seems fast right now is that we've had to be innovative in how we handle all the bureaucracy and red tape of this process. This might actually change the way that we approve vaccines going forward. So contrary to popular belief, the EUA process is actually quite extensive. Next slide. And then the other question is, many people have asked, is the mRNA vaccine seems like new technology? Well, actually, it's been studied for more than 30 years. And how the vaccines work is that the virus has a specific spike on the edge of it that allows it to attach to cells to infect them. And what the vaccine has done is create the blueprint for just that spike that enters into our cells and teaches our cells how to attack this virus next time it encounters it. So it's a memory system that goes into effect. And then this blueprint leaves our body, does not interact with our DNA in any way. Next slide. So I love this visual. Vaccination is so important. It is and continues to be our greatest protection against the Delta variant. Because as Dr. Yunus said, yes, you can get COVID after vaccination, but it's typically mild disease. So yes, you can get COVID after vaccination, but typically you have a much milder course than if you were not vaccinated. Next slide. And so coming back to schools. Now, I am the mother of a Los Angeles Unified student who is too young to be vaccinated. She will be entering 2nd grade this year. And so I understand the anxiety parents are going through. But I want to offer you 2 different perspectives that I have. One is that as a pediatrician, I have read the studies from the CDC, and the studies show that the rates of in-school transmission can remain low if you have the appropriate mitigation measures in place. My second perspective is that I work for LAUSD, and I have personally seen the mitigation measures we're putting in place. That is our upgraded air filtration systems, our required masking for all students, staff, and visitors, our robust testing program, our daily health checks. So it's a layered approach creating multiple layers of protection around our children. And so I feel comfortable sending my daughter to school on Monday. She's so excited. And I encourage you, if you have any family members who are eligible to be vaccinated, get them vaccinated. Protect our children. I wanted to share this picture of my daughter going back to school in spring 2021. It was one of the most exciting times of her life after being home for so long. And finally, next slide. I want to share with you one of the best days of my life, minus the birth of my children, obviously. But December 20th, 2021, best Christmas present also, when I got my first dose of the Pfizer vaccine. I cried tears of joy, tears of relief, tears of gratitude I got vaccinated first and foremost for my mother-in-law and also for my uncle in India who passed away from COVID. Why? Because he did not have access to the vaccine. I got vaccinated because they did not have a chance to. And I got vaccinated for all the frontline workers who put their lives on the line this past year. And so I encourage you to think about it as well. And I hope this presentation was helpful. Thank you.
For doctors and one more doctor who's doing vaccines right here. We are so encouraging them. Dr. Abraham from Kedron.
Hello, hello. All right, did anybody get vaccinated today? Woohoo! I think there's someone out there. Let's give them a round of applause. It's a very joyous occasion, and that's how it should be every time anyone gets vaccinated. This is a celebration, and this is how we get back to life, back to work, back to school, back to loving our loved ones and doing all those things that we missed doing and that we love to do. So let's get vaccinated. It's one of the most important and effective strategies at protecting our families, ourselves, our community. So we'll go ahead and advance. I'm going to try to move through these slides very quickly because actually Dr. Malhotra actually covered a lot of the information that I'm going to cover. So really want to make sure there's time for questions as well. And we'll stick around after. And if anybody needs a vaccine, we're really excited to be able to present and offer vaccines and testing here today. Vaccines are safe, effective, and free. If you hear anything else today about vaccines, that's really what I really want you to leave. And I hope that each of you are activated as ambassadors to go and tell your households, your coworkers, your church members, the people in our community that vaccines are safe, effective, and free. Why delay? Let's get vaccinated. If we can keep going, and let's go ahead and move along as well. So just a little bit about us. We got into this vaccine epidemic because, as Dr. Malhotra mentioned, this past year, these past 15, 20 months have really been challenging for all of us, not just here in LA, but around the world. We have dealt with these challenges that we have not lived through personally. And so we all have to step up and rise to the challenge. And we did what we had to do in December. We picked up the phone and we called our Department of Public Health and demanded where are our vaccines, because we knew our community needed to be protected, especially our community that can sometimes be overlooked, may not be prioritized. And so we fought very hard to make sure we get vaccines for South Los Angeles, for the Black and Brown community. And so it's very important, you know, these are your vaccines and people have fought so hard to bring them to us. And we want to make sure that people know they're theirs and please take them proudly. Let's move along. And so just some of the key facts. Let me just move this, sorry, looking at my slide. So as Dr. Malhotra mentioned, it's key to protecting ourselves and to helping us end this pandemic. As Dr. Malhotra mentioned as well, we're talking about layers. So in addition to the distancing, the mask wearing, hand hygiene, vaccines for those that are eligible, children ages 12 and older, it really helps protect everyone, including those that can't get vaccinated, because then you're one less person that COVID-19 can infect. I'm not going to go through a lot of the details of the slides here, but you know, what is COVID? It's a virus very similar to the type of virus the common cold might be, but this one has these spikes on them and they bypass and sometimes enter our body and they wreak havoc on various organs, whether it's our brain, our lungs, various parts of our body. And so this really is a serious illness. We can go on to the next slide. And so we know that COVID has affected different bodies differently. That's why it's not enough to just eat healthy, which we need to do, move, absolutely, sleep well, reduce stress. You know, if you're taking supplements or taking good care of yourself, do those things. But even for a young, healthy person doing all those things, we've seen people get COVID, get hospitalized, and we've even seen young and healthy people die from COVID. So that's why we really, you hear this passion, you hear this sense of urgency from many of us in the medical and public health community. There's really just not a moment to lose, not a drop to waste. We have needlessly lost over 600,000 people due to this pandemic, and now truly a preventable disease. And so that's really an important take-home message. We can prevent people from dying from COVID-19, and the most powerful way we can do that is by getting vaccinated. So we know that COVID-19 is spread through the ways that Dr. Malhotra and others, as you've heard, through talking, coughing, singing, all of those things. So we really want to be mindful of that, and all the strategies that we'll be using throughout this next school year, help prevent the spread of disease and keep our children safe. And ultimately, that's really why we're here, and that's what we want to accomplish. We'll go along. So there are 3 different vaccines that are available that have achieved this emergency use authorization: Pfizer, Moderna, and Johnson & Johnson. They all work in different ways. Pfizer and Moderna are mRNA vaccines. You saw that wonderful image that Dr. Malhotra presented earlier. So really, this is a vehicle, and it is providing you that information, and then your body is able to recruit those cells, those antibodies, and really get to work at fighting COVID-19 if you come into contact with it. So you want that defense, and that's really what these vaccines do. Johnson & Johnson uses a different technology similar to what we do with the flu shot. So one and done. All 3 are great at preventing death due to COVID, very good at preventing hospitalizations and serious illness. And again, many of you all have known about the common side effects of COVID. So if you're symptomatic, please stay home, please get tested. As was already mentioned, testing is a critical piece of our strategy. Next. And so I know on everyone's mind, as everyone up here has, been really reminding all of us, we want to know that these vaccines are safe. Vaccines are safe for our children. There are studies. There was a recent study 2 weeks ago in the Journal of the American Medical Association that showed no relationship between these vaccines and causing any infertility or affecting people's reproductive organs. I know that's important as our children are going through puberty, people's bodies are changing. Really want people to know vaccines are an important part of keeping us safe from the time we're born until much later in our lives, and that's the same for these vaccines. And as was mentioned, they've gone through a robust process, even though they're emergency use authorized. It's a rigorous process. We've just accelerated it, and we've done steps simultaneously so that we can actually get these vaccines out as fast as we can, ultimately so that we can end this pandemic. Moving right along. And remember, you're not alone. Over 4.4 billion doses have been administered globally now. So we're really proud of everybody that's getting vaccinated, and this is absolutely how we're going to end this pandemic. Will we need a booster? Too early to say. We're going to watch the science. As you've heard, the FDA may very well say in the next day or 2 that some people may benefit from a 3rd shot booster. We're going to watch that. Will we get these vaccines every year? Still too early to say. We'll continue to monitor that. We are expecting that children ages 5 years old to 11 years old may be eligible, maybe as early as late September, early October. So again, more people in the community that will be able to be protected. And so we'll continue to monitor these situations closely. We are doing everything we can to protect ourselves. The viruses are doing everything they can to hang on and stick around. So we're going to watch those variants, those mutations, those new strains closely, and we'll continue to adjust all of our strategies, including making sure that our vaccines work so that we can get past this and move on with our lives. All right, so do stay in touch. And if you have any questions, please put them in the chat box. Otherwise, we'll stick around and answer them after.
Awesome. Thank you. So great to hear all of the medical science. And last but not least, what does it feel like coming back on campus? Mr. Kim, one of our great principals.
Oh, well, thank you for having me. I just want to first give a shout out to all of our teachers, our counselors, and support staff in Board District 7, but throughout LAUSD, just really for showing your dedication these last 18 months in such fluid situations. Really, everyone stepped up to help our kids, and I thank you, and I'm sure everybody thanks you. My name is Alex Kim. I am the proud principal here of Edwin Markham Middle School. I have had the honor of serving the Watts community for 9 years now. And I just wanted to get into some of the things that we are doing in preparation for a return to in-person school. Just on a side note, we started orientation and it felt really good to see families and students on campus. Just the excitement and in the anticipation of going back to a sense of normalcy in our schools has been quite uplifting and just a really good feeling. So the new Markham, our vision here is soaring to uplift our community, and we place our emphasis in 3 major buckets. The first is to provide academic and socio-emotional supports to all of our students. The second is to provide those enrichment programs and activities necessary to not only engage our students in school, but to show them different pathways that they could potentially take and spark interest that they may not have known existed within them. And then our third bucket is in implementing the nation's top instructional program with the nation's top rated curriculum in math, science, history, and ELA. Next slide, please. So what will this look like? Here is a preview of what this will look like when you step on to the campus of Edwin Markham Middle School. We have the pleasure of working with over 40 partners, mental health partners, as well as enrichment programming partners. And so this is something that you will see. You will see, collaboration between family members and partners like Brotherhood Crusade, Crittenton, the Watts Task Force, We Care Ministries, Grid, Crossroads, just to name a few, in order to meet any of the socio-emotional needs that our students may need. We understand these last 18 months have not been easy. And so we are ready to rally around each and every child and get them whatever it is that they need, as well as our families, to ensure that not only are we physically healthy, but emotionally we are sound. Next slide, please. And in addition, it's a little glitchy, but the next slide shows all of our amazing enrichment programming partners. Do we need to reset? Thank you. And I see some in the building today, Unusual Suspects Theater Program. Thank you so much for coming today to represent. They run an amazing theater program at Edwin Markham Middle School. In addition to the Peace Players, American Youth Symphony, Amanda Foundation, the Boys and Girls Club of Carson. Special shout out to the Boys and Girls Club of Carson who run our after school program after school. But it's really, we are focusing in to engage our students, to make sure that they are okay, and to rally around them and provide them all of the services that they need that can benefit them, because in the end, our students are going to take over this world and lead it and change it for the better. Thank you all for being here today.
Thank you, team. Okay, we've had several questions come in the chat. I've tried to answer some of them. We know a few in the room. I think one big one is, what happens when someone tests positive? What happens to the student? What happens to their classmates? Can they keep learning? What does isolation and quarantine look like?
So,
We can.
okay,
we can go back
I'll
to it.
hand it to you. So great question. So when a student tests positive, our community engagement team quickly acts to notify that student. We then find out who the close contacts were in the classroom, and the community engagement team will work to also quarantine the close contacts. We are quarantining vaccinated or unvaccinated close contacts for the safety of our community. Then we work with public health to work to eventually release the people from quarantine. So the guidelines are as follows. If a child is positive, there is an isolation period. If you're positive, it's called isolation. If you're a close contact, it's quarantine. So if a child is positive, there's an isolation period for 10 days. If the child is asymptomatic, they just isolate for 10 days, and then you have to be cleared by our community engagement team to return. If a child is symptomatic, having symptoms, they have to be, it has to be 10 days from their onset of symptoms, and they have to be fever-free for 24 hours. Again, public health and community engagement will work to clear the children from quarantine, from isolation, sorry. If you're a close contact, it's called quarantine. So if you're a close contact and you have no symptoms, if a child is close contact and has no symptoms, public health has said they can test again on day 5 and return back by day 7, day 8. Again, community engagement team and Los Angeles County Department of Public Health will work to clear everybody. So we are working closely with Public Health Department to make sure all of these cases are taken care of in the safest way possible. And the other question was about learning, so I will transfer it.
All right, thank you, Dr. Malhotra. Appreciate that. And as far as learning, whether you're a student, if you contracted COVID, and you were in isolation, or if you were a student in quarantine, the learning for that student would continue. They would be, of course, at home, but their learning would continue. We would work with the school to ensure that they have a continuity of learning, and whether they're at home, getting those lessons and continuing with their learning. As far as looking back at the question, as far as notification, again, going back to Dr. Maltra touched on it, but the community engagement team would contact the family, of course, of the student who had COVID, or the students and the family if they were a close contact. So they would contact those families. So let's use a second grade class as an example. So you have a second grader. The community engagement team would contact, again, that student or the close contacts. The classroom next door that is second grade, they're not going to contact, because it's really for the students that have COVID or the close contact. So the second grade room next door would not be contacted. Hopefully that helps.
And the principal would be notified of as well.
Great. Okay, another question's coming up, and I'll be curious the school site perspective too on physical distancing. What is the guidance now, and what happens at lunch when kids might have their mask off for 10 or 15 minutes having lunch? Who wants to take that one?
I can take that question. The current guidance from our LA County Department of Public Health does not have any physical distancing requirements. The important thing is we want to make sure that we have capacity for students to come back in the classrooms. The recommendation is, when possible, try to, the image that we have is actually an arm's length. That's what the image that the County Department of Public Health shared. So an arm's length. So I know schools are preparing lunch tables, seating arrangements to ensure as much as possible students are far apart as much as possible, but there is no specific feet. I know people were looking at 6 feet before, now there is no square footage.
And keep in mind our layered approach. So we have the masking, we have the testing, we have the air filtration system. So we have multiple other layers of protection.
And I think that's what actually convinced me. I was chatting with a parent earlier that these layers of protection, someone shared it recently like a Swiss cheese, right? There's a little bit of hole here, a little bit of hole there, but you don't want the holes to line up. And so you do lots of layers of protection. So the virus would really have to swerve to get through, right? So if we have our testing, we have our vaccines, we have cleaning, we have masks, all these things in place make it very unlikely that it will be transmitted at school. That helped me feel really confident. And so I just appreciate hearing that over and over. The cleaning is a question that's come up. Maybe Mr. Kim, what's the plan for our custodial team? How often are they cleaning?
First of all, I know for Edwin Markham Middle School, the safe and health and safety of all staff and students is priority. So we have an amazing buildings and grounds crew at the end of every day. They do get in there and they use the electrostatic machine to sanitize each and every classroom. So that is going to continue in addition to our B&G staff going into restrooms after every transition period to sanitize, to make sure that the cleaning is maintained and it's upkept throughout the day.
And another question that's come up, I appreciate the healthy skepticism. And so maybe for Dr. Abraham, is LA Unified listening to science? Do you think we're doing a good job as a doctor in the community?
Yeah, I'll answer that by saying we now know a lot more about coronavirus, about COVID-19 than we did as early as January, March of 2020. So we've really come a long way, which is why we feel very comfortable and confident from public health and from medicine to safely open up our schools. We really know how we can protect our community. We know a little bit more about how this virus transmits from person to person. And transmission is actually lower amongst children to children because of the receptors, because of how COVID spreads within someone. It actually transmits less amongst children. So in many ways, children are going to be very safe going back. We have the tools necessary to be safe, and we know more about how to treat and how to manage people with this illness. And that's very important for all of us because we do ultimately need to be able to get back to doing all those things we need to do, including work, school, play, etc.
Yeah, these are great questions and they're still coming in the chat here. I think a big one is around trusting our students to follow the rules. And so we've got some educators here, folks working at the district, our staff, our students. We have a lot of information, but are kids really going to keep their masks on? Are we really going to ask everyone to wash their hands? What's that been like? And what do we expect it to look like going forward? Start with Pia.
So having had a chance to spend time a lot with our schools, they do it. The kids are very resilient. I myself, parent of 2 high schoolers and an elementary school student, and they listen to their teachers, let me tell you, sometimes even more than they listen to me. But nevertheless, what we saw at schools is that they follow the rules. The teachers are just so engaging and the students are just so excited to be back that they follow the rules. They put on the mask. It's not an issue. The teachers work with them, and really the gratitude to the teachers because they really help create this community that we belong together. We want to be safe. And those rules that they have in the classroom really helps reinforce and make them feel like, hey, we're doing this together. So really, I didn't have any, the teachers thanked me. The principals thanked me. The students were grateful. They're just happy to be with their friends and to do whatever it takes to get them back.
Thank you. And another big fear question, because sometimes we have to ask multiple times in multiple ways, but for both of our doctors, we're hearing Delta is more transmissible, and we're really worried about this. How can we be sure that our kids are safe on campus?
Great. I'll start and then we'll have Dr. Malhotra add on to it. Absolutely. It is concerning and you're hearing it in the news. But again, what we've seen is that Delta variant, the Delta, mutation, it spreads from person to person more, but we don't have any reason to believe that it is more deadly. So that's very important that we have the tools that have been protecting us, but more people are getting infected, even those that have been vaccinated. Of course, that is concerning for people that there are vaccinated people with breakthrough cases, but what they're getting are either asymptomatic, no symptoms at all, or very mild cough and cold symptoms. So when we look at 99% plus of the deaths currently happening due to COVID-19, they are in the unvaccinated. When we look at the hospitalizations, 92% plus of the people hospitalized are unvaccinated. Really tells you the power of these vaccines, even with the Delta variant. And we're going to continue to monitor all the various strains that are coming. But the best thing that we can do is to be responsible, hold each other accountable, and take those precautions and minimize our risk. We talked about the Swiss cheese model. We talked about the layers of protection. All of this is about reducing our risk so that we can do these things safely, including making sure our children are educated.
I don't know if I would add more to that. That was amazing. Yes, the greatest protection against the Delta variant continues to be vaccination. The best way you can protect your young unvaccinated child is to make sure all the adults around that child is vaccinated. In addition, the Delta variant, the mitigation measures we have in our schools are still protective. So, so the masking, the testing, we're testing everyone every week. So we still have all those layers of protection for our children.
Awesome. Well, thank you so much. We're going to stick around in person, and in the chat, we're going to drop a lot of information about how to stay in contact with us, how to get your COVID test if you haven't yet, your vaccine if you haven't yet. But communication and conversation is key to making sure we all feel safe and healthy, ready to come back on Monday. I do want to invite everyone to stay in touch with us, and our contact information will be on the screen in the chat. We do monthly newsletters for our partners, our families, our educators, and we're going to stick around for a little while to answer some more of your questions. Please follow us on social media. That's where you'll see lots of our information posted as well. And we would love your feedback, whether you're online, we have a link we'll drop, or in person, we have a hard copy to give you about how we can do these things better, how we can make sure we're meeting your needs. But again, just from all of us here at LA Unified in our community, we want to encourage encourage health and safety. If you can, get vaccinated. If you can, get vaccinated. If you can, get vaccinated. Thank you so much. We can't wait to see you at school on Monday. Have a great evening, everyone. Thank you. Thank you. Thanks. All right. Woo.